Good morning. Today's class is on the drugs used in the treatment of respiratory disorders, more specifically cough and bronchial asthma, and one or two words about respiratory stimulants. At the end of this class, you will be able to classify drugs used in the treatment of bronchial asthma, classify drugs used in the treatment of cough, the different types of cough, and name one or two respiratory stimulants. So we will be talking about drugs used in the treatment of bronchial asthma, drugs used in the treatment of cough, namely expectorants, antitussives and mucolytics, and analeptics, that is respiratory stimulants, and pulmonary surfactants. Bronchial asthma is described as hyper-responsiveness of the tracheobronchial tree to a variety of stimulants. It is reversible airway obstruction. Now, the classification of drugs used in bronchial asthma, the major group are the bronchodilators. Under that, we have sympathomimetics, more specifically beta-2 selective agonists, which is a 5-mark question. We have salbutamol, levosalbutamol, salmeterol, formoterol, phenoterol, berbuterol, and reproterol. Then we have the METHYLXANTHINES, namely aminophylline, theophylline, etophylline, and toxophylline. Then used prophylactically in the treatment of bronchial asthma include the corticosteroids, inhaled corticosteroids, which again can be a 3-mark or a 5-mark question. Diclomethasone, budesonide, fluticasone, and fumizolide. Then we have the anticholinergic inhaled prophylactics, ipratropium and tiotropium. MAST cell stabilizers include bromelain and metochromate. Lipooxygenase inhibitors, xylitol, and leukotriene antagonists, zafirlukast and montelukast. Then we have the antihistaminics, ketotifen and azelastine. The mechanism of action of the sympathomimetics, more specifically the beta-2 selective agonists. Beta-2 receptor stimulation in the bronchial smooth muscle results in bronchodilation. In addition, there is inhibition of the mediators of inflammation, which play a major role in bronchial asthma. There is enhanced ciliary activity by the beta-2 selective agonists, so there is enhanced clearing of mucus. The most widely used beta-2 selective agonist is salbutamol, given by intravenous, intramuscular, subcutaneous routes, and major route is inhalation route. Salbutamol undergoes extensive hepatic first-pass metabolism. The oral dose of salbutamol is 2 to 4 milligrams 3 times a day. By inhalation route, 100 microgram per puff every 4th hour, or 500 micrograms subcutaneous or intramuscular, and 250 micrograms slow intravenous, or 2.5 to 5 milligrams by nebulizer. So the important doses you need to know is by the inhalation route 100 micrograms per puff, or if it is by nebulizer it is 2.5 to 5 milligrams. The common adverse effects associated with the beta-2 selective agonists include skeletal muscle tremors, vasodilatation, reflex tachycardia, palpitations, and headache. Adrenaline is a non-selective sympathomimetic. Isoprenaline has predominant beta agonist action, but it does not differentiate between beta-1 and beta-2. Orsiprenalin is comparatively more beta-2 selective when compared with isoprenaline. Terbutaline is more selective than orsiprenalin. But among the beta-2 selective agonists, salbutamol and levosalbutamol are the most widely used. The other drugs, salmeterol, formoterol, phenoterol, berbuterol, and reproterol, when compared to salbutamol, they have a slower onset of action and a longer duration of action. So these are used mostly in preventing an acute attack because they have a slower onset of action. For an acute attack, salbutamol or levosalbutamol is the drug of choice. The methylxanthines. The mechanism of the methylxanthines, that is aminophylline, theophylline, is complex and includes adenosine antagonism, all this in the bronchial smoke muscle, inhibition of phosphodiesterase, so cyclic AMP levels increase, resulting in bronchodilation, contraction of the diaphragm improves, respiratory center is stimulated. The adverse effects associated with the methylxanthines, that is aminophylline, theophylline, etophylline, include tremors, restlessness, convulsions, diuresis, anxiety, and insomnia. And most of these are due to CNS stimulation. Aminophylline, the dose of aminophylline is 250 milligrams in 20 ml of 10% dextrose given slow intravenous. The mast cell stabilizers are used in preventing an acute attack. So when there is an antigen-antibody reaction, the mast cell membrane ruptures, releasing large quantities of histamine and other bronchoconstricting mediators. So by stabilizing the mast cell, this release of histamine is prevented. So they stabilize the mast cell membrane, prevent degranulation and release of the chemical mediators of inflammation, mainly histamine. The adverse effects associated with the mast cell stabilizers, that is cromolyn, also called cromolyn sodium, and metochromyl are rare and include angioedema, bronchospasm, and joint swelling. Cromolyn sodium is also used in the treatment of allergic rhinitis as nose drops, allergic conjunctivitis as eye drops, and in the treatment of aphthous ulcers as a gel to be applied on oral ulcer. Glucocorticoids are not bronchodilators. That is to be understood very clearly. Glucocorticoids are not bronchodilators. So what is the role of the glucocorticoids in bronchial asthma? Glucocorticoids are powerful anti-inflammatory drugs. They suppress inflammation. Glucocorticoids decrease bronchial secretions. Glucocorticoids increase the sensitivity of adrenoceptors to the catecholamines or any adrenergic agonist. So salbutamol along with glucocorticoid, the sensitivity of beta-2 receptor is increased. Adverse effects because of local immunosuppression, there can be oral candidiasis and dysphonia. Dysphonia means patient experiences pain in the throat while speaking. The commonly used inhaled glucocorticoids in the prophylaxis of bronchial asthma include beclomethasone, budesonide, and fluticasone. All these are administered by the inhalation. Treatment of severe acute asthma is a 5-mark question in your exams, theory. Also, you have a prescription writing exercise in your practicals. So, the drugs used in the treatment of severe acute asthma, earlier it was called status asthmaticus. 2.5 to 5 milligram salbutamol administered by nebulizer, methylprednisolone 125 milligram intravenous, humidified oxygen 100%, intravenous fluids to reduce the thickness of the bronchial secretions. If the attack was precipitated by an infection, appropriate antibiotics. So to remember easily, excuse me, the drugs used in the treatment of asthma include aminophylline, salbutamol, theophylline, humidified oxygen, the methylxanthines, and antibiotics. Now coming to the drugs used in the treatment of cough. Cough is a reflex. So when does this happen? When there is a foreign body lodged in the respiratory tract. Cough can be of two types, productive and non-productive. Productive cough means that is there is sputum coming out along with cough. Non-productive or dry cough. These are the two types of cough. Coughs. Antitussives are drugs which suppress cough and they act centrally in the brain. They act on the cough center and suppress cough. The opioids have this property of suppressing cough centrally. The major problem associated with the opioid antitussives are abuse potential and constipation. Commonly used opioids. as antitussives include codeine, folcodeine, hydrocodone, oxycodone, dextropropoxyfen, levopropoxyfen, and noscapine. So antitussives are useful in treating useless cough. So what do we mean by useless cough? That is when cough is dry, non-productive. So when cough is non-productive, it needs to be suppressed. We use the antitussives. Expectorants are drugs which encourage productive cough by increasing the volume of bronchial secretions. Guaiacol and guaifenesin. These increase both bronchial secretions and mucociliary activity. Potassium citrate, potassium tartarate, potassium chloride, potassium iodide, and ammonium chloride. These are commonly present in most of these so-called cough mixtures, and they have more of a placebo effect. Mucolytics is a 3-mark question. So what is a mucolytic? A mucolytic makes the thick mucus secretions of the tracheobronchial tree into more liquid so that it can be easily brought out or expectorated. The commonly used drugs are ambroxol, bromhexine, acetylcysteine, carbocysteine, and methylcysteine. These drugs contain sulfhydryl groups that open the disulfide bonds in the mucous membrane and reduce its viscosity. That is, they make it more liquidy so that it can be easily expelled. Administered by inhalation route, by tablets, or by instillation. Most common indication for the use of mucolytics are cystic fibrosis and in the care of tracheostomies. Adverse effects minor include gastrointestinal irritation and allergic reactions. Analeptics are drugs which stimulate respiration. So when does one need to stimulate respiration? If there is poisoning due to a CNS depressant. So they increase the rate and depth of respiration by directly stimulating the respiratory center. Nicotinamide, roxapram, aminophylline, and caffeine are the commonly used analeptics or respiratory stimulants. Because they are CNS stimulants, they can cause convulsions and cardiac dysrhythmias. Respiratory stimulants or analeptics are used in the treatment of acute respiratory failure, apnea in preterm infants, and respiratory depression in opioid poisoning. Pulmonary surfactants. What do these drugs? What is a surfactant? Surfactant is a substance which reduces surface tension. So these drugs reduce surface tension in the alveoli and prevent their collapse. Colforceryl palmitate is given endotracheally in respiratory distress syndrome. So with this, we complete the drugs used in the treatment of respiratory disorders, most importantly bronchial asthma. So the possible main question includes: classify drugs used in bronchial asthma, describe mechanism of action, uses and adverse effects of salbutamol. Please remember, salbutamol is also used as a tocolytic, that is uterine relaxant in preterm labor. The other questions are inhaled corticosteroids, then mast cell stabilizers, name 3 analeptics. These are the possible questions. Thank you.